Hello everyone. Thank you so much for attending today's presentation for the League of California Cities Health Benefits Marketplace. I'd like to very quickly go over a little bit of housekeeping. So all attendees are in listen-only mode. If you'd like to ask a question, you can go ahead and click on the questions box on the right-hand side of your screen and type that in. All of our questions will be addressed at the end of the presentation, and we'll go through that as well, just to make sure everybody has clear instructions at the end. Chris?
Thank you very much. Good morning, everybody. This is Chris McKenzie, Executive Director with the League of California Cities. I want to welcome you as well this morning to this important webinar. Our speakers today, as you can see on the screen, are Barry Eyre, who's a partner with Diversified Benefit Strategies and a consultant to the League on the marketplace. John Andrews, sales leader with Willis Towers Watson, and Pat Kelly, from whom you just heard, sales director for Connexure. As you know from your own experience, cities face a number of challenges when it comes to employee benefits, not the least of which are ballooning unfunded OPEB liabilities, a lack of flexibility in plan designs through CalPERS. We've heard this over the years. Also, there's a need to cover both active and retirees and finding the right plan that works for both without the implied subsidies that we're now having to report is a challenge. And then finally, healthcare costs are consuming a higher percentage of local agencies' budgets. Over the past 18 months, with the strong support of the League's Board of Directors and a number of committees, we've evaluated options for addressing these challenges for both employees and retirees and their agencies. And we ran a competitive request for proposals process in order to seek the right private partners in developing a solution that we're going to share with you today. Connexure was chosen as the partner to run the active employee solution, and Willis Towers Watson was chosen by the League as our partner for the pre-65 and Medicare-eligible retiree solution. We have negotiated contracts with both firms tailored to meet the needs of public agencies in California. These contracts are available to all public agencies that choose to participate. So with that introduction, it's now my pleasure to turn it over to Barry Eyre, our consultant, who's going to talk to you about the health benefits marketplace and why this technology solution is going to make the delivery of health benefits easier and more cost-effective for you and your entire workforce. Barry?
Thank you very much, Chris. So the first slide really kind of shows you the overall scope of what we're trying to accomplish with the health benefits marketplace. So as Chris mentioned, we're trying to put together a solution that's going to encompass health benefits for both your active employees and retirees and their individual needs. You have very different needs in terms of the types of plans and ancillary benefits for active employees versus your retired population. You know, retirees are typically taking advantage of Medicare, very different market than the active employee plans. Also, we wanted a structure that was going to be very flexible in terms of funding mechanisms, whether self-funded, defined contribution, and things along those lines. And so what we've come up with by marrying these two best-in-class providers is a very flexible environment which will allow you to meet the needs of all the cohorts of people that are dependent upon your public agency to provide health care. So that was our real goal here. And this slide is really just giving you a kind of a sense of the scope of what we're trying to accomplish. So Pat Kelly is going to explain about the active employee platform now.
Thanks, Barry. So over time, as many of you know, the employee benefits landscape has changed quite drastically. in terms of what we are to solve and the different ways that we're able to drive efficiency and produce savings, there's a circle of life that includes not only the technology included with the health benefits marketplace, but allowing for networking carrier efficiencies to help drive savings. We've built in a wellness program that is integrated with the marketplace, which we'll talk a little bit more about later. Consumer-driven plans, allowing for flexibility for cities to offer multiple plan designs while giving employees the tools to right-size those plans for themselves. All of the different administrative efficiencies that go along with administering benefits. So having electronic feeds to the carriers, having a HR and benefits portal for not only your HR staff to run reports and things like that, but also getting outside of paper or spreadsheet type enrollment processes. And finally, we have an integrated ACA tracking, reporting, and e-filing service. So not only are you able to aggregate all of your employee benefits data in one system, but we're also able to help you with the tracking of variable hour employees, the reporting, and then ultimately the e-filing and all of the different types of reports that have to go out to your employees. So when we talk about choice and we talk about consumer-driven plans, there's a vast majority of people that consider 10 health plan choices a good amount. So when we look at the amount of plan choices as compared to the typical 1 to 2, maybe 3 plan choices, everybody has different types of health care needs. Now, 10 plans may sound like a lot to some of you, and that's really why we have developed all of the tools that come with our technology for enrollment purposes. So people need a cost comparison tool, a time-efficient process, and want personalized recommendations to go along with all of that. So when we take a look at all of the different efficiencies that all come with on the back end of the system and with the carriers and the different types of integrations with those stakeholders, we also have to have the right tools in place to allow for those people to be able to make those choices and make the right choices. So I'm going to hand this off to John Andrews, and he's going to chat a little bit about the retiree benefits.
Okay, thanks, Pat. So as you heard Barry mention earlier, for retirees, we are considering using an alternative marketplace from using individual plans within the health benefits marketplace. And the reason for that is those individual plans have been found to include efficiencies that are not available to employers within your own group plans. So what I'd like to talk about a little bit is that marketplace and why it's significant in its size and efficiency as the alternative to what's offered to retirees today. So when you think about the individual market, the risk pool is huge in comparison to any given employer. Many of your retiree populations are very large and you have good buying power within those populations now, but they don't compare favorably to 40 million lives, for example, that are in the Medicare marketplace. About 8 million of those lives that are Medicare eligible, to give you an example, are still in some type of employer-sponsored group plan. So roughly 32 million lives are already in the individual Medicare market, giving you evidence of how large that really is. Guarantee issue is a key here. So when the employer terminates the existing group plan, that causes qualification for a special enrollment period, allowing all of the retirees to access this marketplace with no barriers. That's a key consideration here for moving to this market. The efficiency from the carriers on their pricing comes from their competition amongst themselves with competing carriers going after the same membership, but also the fact that they have access to federal subsidies that are no longer available or no longer as efficient as they are available to employers. So they're basically able to package plans in a more cost-effective manner. And the last thing to mention is this applies to both the pre-65 retirees and the Medicare population. The Medicare marketplace is much more mature. Those plans have been around for longer. The pre-65 plans have been available to us since the advent of the Affordable Care Act. So the individual plans, for example, within Covered California, are an example of what can be offered to retirees that are pre-65 as the alternative to the group plan today. So what the exchange is doing, what the health benefits marketplace is doing, is it's empowering our employers, each local agency, to independently make a decision to use this technology to access this individual marketplace instead of offering that group plan. That's really what this is about. So next, what I'd like to talk to you about is how this savings comes around to the employer. So what we're portraying here is a comparison. The orange shading is showing as a general rule, we're seeing trend for retiree group plans, group medical plans, to follow annual trend somewhere around 10%. Sometimes it's greater, sometimes less. But that's the benchmark that we're comparing to. The green segment of this graphic is showing you the potential savings that we believe are available from using the individual market, and we're also identifying the different contributors to why that savings can be achieved. So I mentioned carrier competition, those federal subsidies that are available to the carriers for these plans, the size and the composition of the risk pools. Even though these risk pools are very large, with the aging population and baby boomers entering Medicare and senior ages, we've got many folks entering this marketplace, which makes it very attractive from an underwriting perspective to a carrier, because those are younger entrants entering this pool at a very significant pace. And then defined contribution is the design within the health benefits marketplace infrastructure that allows you as the employer to set your cost, your subsidy, at a predictable value, therefore achieving predictable results. So the accumulation of these savings many times reaches 25%, which is a number that can be entirely passed on to the retiree, or some of that can be saved by the employer as well, and that defined contribution method is where you're setting that mark. Now, everything I'm talking about here is really on a cash basis. So when this is defined and you have a defined contribution subsidy going forward, the result is that the OPEB liability, the GASB liability that each of you are burdened with, is significantly reduced. And we see that many times as a factor of 10 to 1. If you're saving $1 cash, the impact to OPEB could be a reduction of 10 times that, depending upon what your assumptions were in your current actuarial calculation. So I'd like to turn this back over to Barry to give you more information about how this actually works.
Okay, so what I want to do here is paint a picture for you of like the different components of the health benefits marketplace. So not only there's the way that your employees and retirees will interact with the system, but there's also the benefits for human resources and administration as well. So sort of like an outward-facing and then the inward-facing component of the marketplace. In terms of the employees and retirees, we talked a little bit about how the consumers will come and have choice, and the system is set up to properly assist your employees and retirees to make decisions amongst multiple plans. There's a lot of support mechanisms for guiding them through those choices, one-on-one counseling for certain levels of choice, and also the whole eligibility and enrollment process can be handled electronically. Now, that's not a requirement for retirees, and retirees don't necessarily like to do everything electronically. It is available to them, but with the retirees, the whole enrollment process can be handled one-on-one over the phone. When we go back on the employer side, though, the fact that this is a technology-focused platform allows for better data management, communications and fulfillment. There's reporting and analytics, and again, Patrick mentioned earlier the ACA reporting functionality, which is an optional service, will ease reporting by gathering information from the platform to make it so that you can meet your requirements to the IRS and then reporting back to your employees by leveraging the technology. So alluded to some of the benefits, some additional benefits. ACA reporting we've already spoken about. This is an add-on service. It's not a requirement that you take it. There's a wellness program which has been embedded into the platform as well, also an optional additional benefit. Wellness programs can be great in order to help with population health management challenges, things to help people live their lives in a more healthy manner and bend the cost curve in terms of medical costs. And so there's a great program built into the system as well. Up until now, we've really focused in terms of populations on active employees versus retirees, but we also recognize that you have a wider population of part-time, seasonal, COBRA people. The platform is flexible enough to be able to address the needs of all of these populations. So the way we like to think about the health benefits marketplace is it is a menu of services that an individual city can pick and choose from to best meet their needs as they currently are. So local control and flexibility are built into the system. So we have, obviously, we talked about it, a system where you can migrate your Medicare-eligible retirees onto the individual market. There's a very robust technology platform for enrollment and then allowing your employees to choose amongst the many various different options. We have, and those are going to include high deductible health plans. I mean, because of the flexibility of the system, you can offer more choice than you would necessarily have been able to do without this sort of technology. Additionally, you can layer in tax-advantaged savings accounts like HSAs and HRAs. We pointed to the wellness program and the Affordable Care Act reporting additionally. Another thing to really keep in mind here is that we break the connection between active employees and retirees. You can make independent funding decisions between your active employees and your retirees. So this is the menu that you have to choose from. So an individual city can choose to engage with the platform in many different ways. For example, if your most pressing problem was that you needed to deal with your OPEB liability, you can just engage with the system, with the platform for solutions for retirees and migrating your retirees to the individual market. And John alluded to the benefits of doing that, but much wider range of healthcare options for the retirees, savings for the city and the retirees, and the possibility of significant OPEB reduction. If you're wanted to deal with issues related more towards active employees, and you didn't necessarily want to go the high deductible health plan, health savings account route, you can use the platform that we put in place to enroll plans like your current plans, maybe add a few extras, and use the technology platform to allow your employees to enroll with the decision support technology, maybe add in the ACA reporting functionality and the wellness offering, and take that first step. And then consider in later years layering on the more consumer-directed programs that I will point to in scenario number 3. So that would be maybe an entry-level choice. If you wanted to start off like really engaging and putting in place the healthcare consumerism ideas that Pat talked about at the beginning, very easy with the range of carriers that we have selected to go onto the platform to add these additional types of accounts with higher deductibles, with health savings accounts, and then the tools in place to allow your employees to navigate through those choices. And so what we see here is you can mix and match any of these strategies to meet the needs of your individual city. We're giving you control over how much or how little of the programs available through the marketplace you choose to access. So in terms of carriers, on the active employee side, we've got a wide range of carriers, very well known. Kaiser, Blue Shield, Anthem, Sharp, and Western Health Advantage are all carriers that are integrated into the platform. So we have a footprint which covers the entire state. We also have the flexibility to bring other carriers on. So if there's a carrier that you wanted to use that wasn't part of the platform, it's flexible enough that we can integrate an additional carrier. The carriers for small groups are community rated. Anything above 100 lives are going to be individually rated with standard carrier underwriting rules. John, if you'd like to speak to the retiree situation, I'll turn it over to you.
Sure. Thanks, Barry. So looking through the lens for retirees, and I mentioned this before, but from an underwriting perspective, we're creating a guarantee issue enrollment opportunity due to the termination of the existing group plan. So that causes an involuntary loss of coverage for the retiree, allowing them to qualify for a special enrollment period. And that special enrollment period gives them free access to the marketplace, no underwriting, no limitations, no pre-existing conditions, nothing would impact them. When you look at the difference in plans for pre-65 versus Medicare, the pre-65 individuals are offered the plans from the new marketplace, which for those that reside in California would be primarily offered through Covered California, plus other carriers that offer plans to consumers that they chose not to file on Covered California. So we refer to those as non-marketplace plans. Covered California would offer marketplace plans, but we also have relationships with carriers that offer non-marketplace plans. And those plans all follow the metals designation that you're likely familiar with, where it shows the benefit value as a platinum, gold, silver, or bronze plan. So they have those menu choices, and those plans are individually priced and based on basically age and gender. From a Medicare perspective, similar approach, but the plans are coordinating with Medicare. So we're offering Medicare Advantage plans, Medigap, and Part D prescription drug plans. And within the state of California, for those retirees that remain in California, we have 16 carriers offering those plans. But for those that do leave the state of California and need access that reside elsewhere, when you look at our national footprint, we have over 100 carriers participating because we basically need to cover every zip code. So that's the composition of carriers and how that works on the retiree side. Barry, I think you're going to talk about voluntary benefits next.
Yes, so we really didn't touch on this yet, but in addition to medical carriers, we have selected a group of high-quality voluntary benefits carriers to also be offered on the platform. So there's a range of sort of the most popular benefits that are available for employees to choose from. Now, these an individual city could choose to have these be employer-paid or purely voluntary. And again, there's decision support around why you may want to choose some of these types of plans to complement the health benefits that you're receiving from the employer. But these are the most popular types of plans, and they are integrated onto the platform already. So next we're going to tell you a little bit about contracting and the timeline. So in terms of the development of the health benefits marketplace, working on contracting was probably one of the longest. We had to devote a lot of effort here. There's two sets of contracts embedded in the health benefits marketplace, and these contracts that I'm talking to specifically relate to the technology platform partners, not the carriers. So the Connecture and Willis Towers Watson. So the League has negotiated master agreements with each of these vendors, which set out the terms of them participating on the exchange, or with the exchange and providing services. And additionally, the League has negotiated model city agreements with each of the the vendors that specifically meet the needs of California municipal contracting. So that doesn't mean that each city, once they get their individual city agreement, if they decided to participate, they can still negotiate terms of the contract. What we tried to do, though, was to get a contract in place that met normal norms of contracting that a city council could accept on its face without having to change any terms. That was our goal. But again, you have the flexibility to negotiate final terms under the contract. And one of the things that I would like to point out is that, you know, in terms of the League's role and status, the League does provide a group purchasing function for its members, and the League is a nonprofit entity. So what this means is the League may, that you may not have to run an RFP for marketplace services. However, each individual city is going to have to make their own determination about that. I'm going to turn this over to Patrick to talk about the active implementation timeline.
Thanks, Barry. So as you'll see here, we have a couple of color codes at the bottom. You as the employer and Connecture collaborating, and you as the employer and then Connecture, and all of the different roles that we play between each other. So beginning our very first discussions will be implementation kickoff and under discovery phase. So what your benefits eligibility looks like, the structure of your contributions, and all of the different nuances and complexities that may come along with your benefits program, so we can properly build those into the system. So that means when you have different payroll frequencies, your employees would only see their contributions for those specific products based on their payroll frequency, or if they have a certain contribution structure based on service, for instance, they will only see their contributions based on those specific aspects of their eligibility that we discover and phase into the product, into the platform itself. So during the first month, we're determining branding, collecting the data, reviewing and completing all of our onboarding paperwork, which are just some basic spreadsheets that collect your plan data, your carriers, if you're bringing your own carriers, or if we are utilizing some carriers that are already pre-built onto the platform. And during the second month is the majority of the heavy lifting is done by Connecture. So outside of you as the employer and your HR folks providing a final census to us, we are building out the platform itself, all of the enrollment file feeds to the carriers, and managing all of that data that we've collected in the last 30 days. So going into the month before open enrollment begins, we would be looking at all of the testing, reviewing and training on the actual platform with benefits administration for HR, for anybody who might need access to that. We are, as Connecture, going through testing of our 834 files, which are all of the electronic files going back and forth between us and the carriers. And once we have fully tested all of that, we go to production testing and go live. And that go live would be the start of open enrollment. So open enrollment would begin with employee communications. We can provide support with that, and also provide you with different types of webinars, webinar support, those types of things, as well as templates that you could utilize for distribution amongst your employees. And then finally, after open enrollment, we work with you to strategize on different communications that might need to go out during the plan year to make sure that people are taking advantage of certain products or wellness or things like that that you've put in place on the platform. So I'll give this over to John, and he will talk through the retiree implementation.
Yep, thanks, Patrick. The approach we're taking with retiree is very similar to active, where we're portraying to you what the various responsibilities are. And we're also presenting this to you somewhat in a vacuum. So because you have the flexibility to implement active on its own, you have the ability to do retiree on its own, or both. These representations of the implementation are shown to you as if you're following each of them independently. But if we were to put these alongside each other, active and retiree, for the same time frame, there's a lot of overlap that occurs and coordination, especially around the communication campaign, that would make this look a little bit differently. But for the sake of today, we thought it would be worthwhile to show you these independently. So when you look at the retiree approach, on the front end, the majority of the time that our employer is working with us is around design, the discovery, like Patrick said, and the planning around your communication content and your subsidy design. And once that's worked together with us, then we really rely upon your role to focus on getting us the eligibility data from the existing platform or sources of where your data resides today. That's the majority of the focus when you think about the retiree phased implementation. Once we have that data, then we're using that to push the communication campaign to the participants, to the retiree participants, to have them understand what's happening. There's an announcement that comes from the employer that explains what it's about, why it's happening, and then we've over the years, actually this has been around for 10 years, so over the years we've evolved our campaign to understand how frequently we should communicate with retirees and how much depth we should get into with each of those communication components. Because one thing that we're trying to avoid causing is anxiety from retirees, because the common reaction that you see from a retiree seeing change is that change is always perceived as bad. And we want to slowly have them understand what's going on, to even include retiree meetings, which we're listing here, that are right before the season begins for enrollment. And those are very effective meetings where they're facilitated in a live session. The retirees have a chance to ask questions. It's not just mail that they're receiving. Obviously, it's a more personal interaction. And then they're equipped to then take action and contact us and make their choices, make their enrollments, and the process begins thereafter. So once the enrollment season begins, you'll see this purple shading start to take over, and that's really where Willis Towers Watson is doing all the work, interacting with the participants directly, making sure that we've touched on everyone and that we've heard from everyone that needs to be contacted, and actually reporting those results back to you so that you have confidence that everyone has been approached and given the opportunity to make their enrollment options. So this is typically around a 7-month time frame if subsidies are included. If there is no subsidy going forward, that time frame can be a little bit less. Sometimes we'll see it as short as 4 to 5 months, but I generally like to plan for 7 months, and if we have the time to make it to take advantage of a longer communication campaign, we actually will take it as well. But this can be set up to follow any given month for which you terminate that group plan. That's why we're portraying it as month numbers. So many of these will happen on a natural January 1 basis, but you have the option to do this March 1, April 1, and so on. That's all triggered around that replacement of the legacy plan.
Okay, so talking about process and timeline now. So we have 2 large cohorts, those cities that are in CalPERS and those cities that are outside of CalPERS. So for those cities that are outside of CalPERS, the platform is available for 1/1/2017. Cities would have to decide whether or not they would like to use the, whether they want to keep their current carriers or migrate to carriers that are on the platform already. We need to obtain quotes from the carriers or integrated onto the platform, and evaluate whether or not you would like to participate in the retiree program as well. So those are the sort of the choices. Once those decisions have been made and contracts have signed, approximately 3-month process to get ready for open enrollment. And so still feasible to do this for 1/1/2017, but it would take engagement starting sooner rather than later. If we move on to CalPERS, and we've had a couple of questions about CalPERS already. As I'm sure you're aware, CalPERS releases its rates in June, and then there is a 2-month horizon, 2-month period where you can decide to opt out of CalPERS. And for this year, that date has already passed. It was August 1st, just passed. So the earliest possible date that a CalPERS city could elect to become part of the health benefits marketplace would be for 1/1/2018. That would require that they make a decision to opt out of CalPERS during the window, and if it's the same period as this year, the date will be August 1st, 2017. Now, CalPERS requires that if you are going to leave CalPERS, you take both your active employees and your retirees out of CalPERS. So you would have to make an evaluation for both active employees and retirees if it made sense to come out of CalPERS and join the health benefits marketplace. CalPERS further has some restrictions on what the carriers that are part of CalPERS can do with regard to cities that are choosing to leave CalPERS. Carriers that are inside of CalPERS are not allowed to provide quotes to cities leaving CalPERS until those cities have made irrevocable notice to leave CalPERS. Once you've given that notice, you are outside of CalPERS for a minimum of 5 years. So there's a little bit of a catch-22. You obviously would like to get the quotes before you come out, but you can't get the quotes until you come out if you're going to be working with carriers that are inside of CalPERS. However, the health benefits marketplace can help facilitate getting quotes from carriers that are outside of CalPERS so that you can have pricing to evaluate whether or not you wanted to participate on the health benefits marketplace before you have been forced to make this irrevocable notice to leave CalPERS. So this is a decision-making process that would really, you wouldn't really even be able to get involved with this process until the beginning of next year. But those cities inside of CalPERS that did want to evaluate the marketplace for 1/1/2018, we would help to facilitate getting quotes from carriers outside of CalPERS. We would work with Willis to evaluate the costs or savings for your retirees, and then you'd have a full financial picture before you decided to make that decision to leave or not. So, Patrick?
Thanks, Barry. So at this time, we're going to go ahead and open it up to questions. So we have Norman and Amanda that will moderate us. And so if you have questions, please go ahead and type those in the questions box on the right-hand side of your screen. And if the question is not addressed, please go ahead and reach us through the website here, cacitiesmarketplace.org, and click on Contact Us, and we can set up a separate time to address your questions specifically.
Okay, thank you. We do have a few questions coming in, and the first question is, so would this replace an agency's current health benefit plan or program?
So I can take that. If the carriers that we are working with on the platform that have already been integrated onto the platform, then you could actually use the same carriers and same plan designs and utilize the enrollment and decision support technology to replicate many aspects of the way your plans look, but add in the ACA reporting, add in the wellness options, and then have a platform which gives you greater flexibility going forward so that you could kind of layer in some of these other health management techniques and plans that I discussed, like the high deductible health plans and health savings accounts. You could also choose carriers that are on the platform and replicate the current benefits that you have and not go the route of integrating your current plans onto the platform. So I wouldn't necessarily say it's replacing. It's a different way to deliver your benefits. It's a way that is more efficient. It's a way that gives you tools, better tools to help manage costs, and it also gives you a pathway to make changes in the future which can have significant impact on cost savings over time. The one aspect that would be replacing, and everything I said up until now really was dealing primarily with the active employees. You don't have to use the retiree plan. So if you have group retiree plan and you don't want to exit the group retiree plan, then you could keep that in place. But if you wanted to migrate to the individual market, that effectively is a replacement of your current plan.
Okay. The next question is for groups under 100 lives. Will they be in the small group marketplace with age band rates.
That's correct.
Okay. Here's a CalPERS question. I'm curious to know how this might compete with CalPERS Health.
Well, obviously this is a parallel system which mimics a lot of the things that CalPERS Health does, although it gives you a great deal more flexibility in terms of choosing the types of plans, the richness of the plans, and also the strategy in terms of what's happening with your retirees is different than what happens within CalPERS. But effectively, if you are a CalPERS city, you could choose to completely remove yourself from CalPERS, opt into the health benefits marketplace, and you've effectively, replaced CalPERS with the health benefits marketplace. One of the interesting things, something that's came up a lot in discussions with city managers about why to do this, although the Cadillac tax has been put on hold, it's still a looming problem, and pretty much all the plans that are in CalPERS we're going to be triggering Cadillac tax, and not a lot of discussion around lower cost options. So with the health benefits marketplace, you can offer more expensive plans, but also layer in these other plans that are less expensive and put incentives in place for employees to take those plans and really have a tool to mitigate Cadillac tax. So yes, it competes with, but what I would say is that it also provides a lot of other flexibility and other tools that you don't have within CalPERS to help manage your costs of providing health care.
Okay, along the same lines of the CalPERS, question is, can you explain the quote situation again for CalPERS agencies?
Sure. So CalPERS agencies are not, the carriers that are inside of CalPERS are prevented from providing you a quote of what your rates would be outside of CalPERS until you have given notice that you are leaving CalPERS, which is irrevocable. So in order for us to provide you a quote, we have to provide you quotes from carriers that are outside of CalPERS. So during the first 6 months of next year, before you were required, that window opens up, that 2-month window from beginning, which ends in August, you would have to get quotes from carriers that are outside of CalPERS to be able to make a decision that it made sense for you to leave CalPERS, give notice that you're coming out, and once that happened, the carriers that are inside of CalPERS would actually be free to provide you a quote.
Okay, and somewhat along those lines, the next question is, can you elaborate on the assistance that cities can expect to evaluate the potential cost benefits of moving to the health benefit marketplace? And then also maybe John can talk about the help or evaluation that could be provided with respect to OPEB cost savings.
Yeah, John, actually, why don't you talk about that, because it's a very structured process in terms of analysis of the reduction in OPEB liability.
Sure. So what we offer is support with modeling the benefit value comparison between the group plan and what could be achieved from the individual marketplace. And it's an actuarial model that basically accounts for the full premium equivalent cost of the current group plan and the out-of-pocket cost of the participant using that plan value. And we use utilization data to test that against comparable value plans and their associated price from the individual market. So a simple way to call it is a winners and losers analysis. And that gives you a basis to make a judgment on what the cash subsidy design could look like in this model. And then with that cash design in mind, which becomes your defined contribution value, then working with your current actuary, we can support helping them revise and make an estimate of what the impact to your current OPEB liability would be. So we don't envision taking over or performing a new actuarial valuation on your liability. However, we do envision helping your current actuary make that determination with new assumptions.
And on the active employee side, you know, the analysis for our cities outside of CalPERS, if we're really looking at matching benefits, you know, it's really a matter of like looking at the quotes that are provided by the carriers that have signed up to be integrated with the health benefits marketplace. But in addition to, you know, just straight comparison of costs, there are a lot of operational efficiencies that are inherent in the system. You know, we described, you know, the electronic process of enrollment, integration with carriers, ACA reporting, things along these value-added services, which are part of the value proposition of the health benefits marketplace on the active employee side. And so, you know, the value to an individual city of those services is really going to depend on what it's costing you to provide those services right now. So, you know, the analysis becomes a little bit more complicated, but the first step is to just look at the quotes versus what you're currently getting, and then make an assessment of the value of the other services. It's a similar kind of process with those carriers in CalPERS. You know, the other thing, though, again, is I want to stress all of the programs that are in CalPERS. Basically, there's a single plan of an HMO provided by about 5 different carriers, and then 3 relatively rich PPOs that are ASO PPOs the Anthem manages. All quite expensive options. You wouldn't necessarily be comparing apples to apples if you decided to look at what your options were outside of CalPERS and on the health benefits marketplace, because you're going to have choices that you don't have in CalPERS by really taking a hard look at your options within the health benefits marketplace. And this is a critical factor here. Having choice, having control over plan designs, and being able to restructure the benefits that you're offering to your employees so that you don't necessarily force them to take a plan which is a lower cost one, but giving them tools that may make it so that they choose that plan for themselves. So again, it's not quite a straight comparison because there's so much more flexibility on the health benefits marketplace than what you're going to see, or for those cities that have been in CalPERS, what you've experienced. But we will help you navigate that and figure out, you know, the best way to evaluate those choices for your city.
Okay, here's a question about dual carriers. Would a group be able to offer both Anthem and Blue Shield to employees? What if my group has high Kaiser enrollment with would Blue Shield or Anthem stay alongside?
Yeah, Blue Shield and Anthem are not going to go side by side with each other. They will go, each of them, side by side with Kaiser. We would have to look at the levels, and it would be part of the underwriting process. It's hard to get into the details of such a specific question without understanding a little bit more and then kind of interacting with the carriers. But you know, that's the general. Everybody's okay to go side by side with Kaiser, but the PPOs don't want to be up against each other. So that's the situation that we're in currently.
Okay, here's a subsidy question. How would a city provide the subsidy to retirees under the program?
That's for you, John.
Yep, I can take that. So the way the subsidy is provided is through a health reimbursement account. And so we are going to administer an HRA that allows for reimbursement to the retiree of a qualified expense. And in this marketplace design, the majority of the qualified expenses will be premium that they pay for the individual plan. So the mechanics of how that works is the retiree enrolls in a plan, they pay their invoice directly to the carrier, so you no longer have to manage either direct billing or a pension deduction, which applies to the current plan. And then they can seek reimbursement from their HRA for what they have paid that carrier. And we've automated that process so that if they want to elect auto reimbursement on a monthly cycle, they get reimbursed without having to file a claim. And so on the employer side, you're basically managing the HRA with the same level of effort as you would manage a flexible spending account if you don't have an HRA today that you have experience with. So it's notional dollars. There's no asset transfer until a claim is presented against the plan, and it's the most cost-effective method to still provide the subsidy without having that value become a taxable income to the participant. That's really why we use it that way.
Okay, here's a retiree dependent question. How will coverage work for a Medicare eligible retiree who still have dependents covered that are not Medicare eligible?
Okay, so that's a split family scenario. And if the employer decision is to move all retirees, which would mean pre-65 retirees and the Medicare retirees, then we would split that family and define their subsidies such that they would enroll in appropriate plans that apply to their age situation. So the Medicare eligible person would enroll in a Medigap or Medicare Advantage plan, and the pre-65 dependent or retiree, depending on where they fall with that age difference, would then enroll in a marketplace plan. If you do not move the pre-65, which that's a scenario that could happen, you only move Medicare folks, we would still split the family. The Medicare eligible participants would enroll in the Medicare supplement plans through the marketplace, and the pre-65, pre-Medicare participants of that family would remain on the group plan.
Okay. The next question deals with pricing. And so is there a cost associated to the city for participating in the health benefit marketplace?
Yeah, this is Barry. So there is a cost associated with participating. There are per member per month charges for utilizing the health benefits marketplace that are graduated based on the size of the population. The wellness program also has its own set of charges depending upon the size of the population, as does the ACA reporting. So any city that was interested in engaging would be able to provide full details about the pricing and how it would work for your city and analysis of what it was likely to cost.
Okay, the next question deals with optional benefits. May a city participate only in the optional benefits?
And yes, I believe that they could. I mean, we haven't, that's something we're going to have to explore. It's the first time anybody has asked that question. Technically, yes. So we could, we can get back to you with a more detailed answer to that question and circulate it to the group.
Okay. The next question is, it appears that a city may keep its own group plan but use your system to provide our enrollment processing. Is that correct?
In effect, yes. So let's say you have United Healthcare, which is not one of our carriers that's integrated onto the platform. If we're only talking about the active employees right now, because the retiree component of the platform requires termination of your current group and then moving all of your retirees onto the individual market. So this answer to this question is purely around your active employees. So if, for example, you have United Healthcare and you want to continue to use United Healthcare, we can build the data interchange EDI connections to United Healthcare so that the plan offerings that you are offering to your employees are built on the platform. So when your active employees log in during open enrollment to make their choices, all your current plan offerings are there, and they're able to enroll electronically. The decision support to help them guide amongst multiple choices would still work, so they would get the benefit of that. And again, all the rest of the features of the platform are available to you. So kind of a long-winded answer, but effectively, yes, you can keep your current group plan and you migrate it onto this platform.
Okay, and for someone that's interested in coming onto the platform, what information is needed to get a quote from a non-CalPERS carrier?
You know, standard underwriting information, census, you know, we'd be able to provide you with, you know, once you engage with us and decide that you wanted to examine becoming a member of the health benefits marketplace, we would provide you with all the list of information that the carriers require in order to provide a quote. But it's nothing unusual. It's your standard underwriting information.
How would introducing high deductible plans impact the affordability factor under ACA?
Well, when we say the affordability factor, I'm assuming that we're talking about the Cadillac tax and the fact that if you have plans that are very expensive, according to some thresholds, that cities or any plan sponsor would pay penalties. High deductible health plans are a way to kind of minimize the overall cost of benefits provided to your employees, and they can be, if they're structured appropriately, will fall below the limits that trigger Cadillac tax. So it's a good way for you to manage your exposure to Cadillac tax by introducing high deductible health plans.
Okay, and I know that this was covered during the presentation, but maybe you can just go over it again. And it's we've had this question a couple of times, and so it is it mandatory to include retirees, or can this be offered only to active employees? Another question is, if we wanted to just target our retirees, COBRA, part-time, seasonal employees, everyone but full-time employees, can we? And so can a small employer only sign up for health care for active employees only? So the theme is the same on all three of those questions.
Yeah, I mean, there's one distinction, one that was slightly different in the COBRA, part-time, seasonal, and retiree cohorts rather than the active employees. And again, that's something that we haven't considered, but technically is certainly feasible. The other questions are really related to the issue of flexibility. You can choose to engage with the health benefits marketplace for just your retirees, just your actives, or your actives and retirees. It doesn't matter whether you're a small city or a large city, and by that means I'm talking about like the 100 life threshold. You can do either actives or retirees, depending, no matter what size your city is.
Okay. Will rates vary by region?
Well, you know, the underwriting is individual underwriting. So the carriers are going to, you know, so that absolutely would vary by region. I mean, we don't have a pooled rate for the entire League of California Cities. So they're going to look and underwrite individually. So yes, there will be regional differences in rates.
Okay.
Also, there are regional differences in rates amongst the community-rated plans as well. So that would come into play for smaller cities.
Okay. Our city is part of the CSAC SDRMA group. Do we need to leave that group if we only want to participate in retiree benefits only on the HR health benefit marketplace?
I think we would need to talk to you a little bit about your specific situation. The board of the league has opened up the platform to all public agencies. So the specific question that you're asking, I don't have the answer to right now, but I'd love to have a chat with you to find a little bit more about your specific situation so I can come up with an answer for you. So we'll follow up with you directly on that one.
Okay. Here's a question. We currently use ADP to manage our payroll, benefit employees, self-service enrollment, etc., and ACA reporting. We have CalPERS benefits. If we went this route, could we set up a carrier connection to and from the marketplace? CalPERS does not allow for carrier connection, so we have to manually input data into their site. Would be helpful if we could send receive data from the marketplace.
Patrick, you want to take that?
Sure. I think that's definitely something that we can take a look at. In terms of being able to send data back and forth between CalPERS, I don't know the specific answer to that. We would need to follow up separately. But in terms of sending data back and forth between ADP for your payroll integration, we can absolutely set that up as well. So we'll follow up separately on the CalPERS comment as following the presentation.
Okay, for pre-65 retirees, are there a significant number of plan options outside of covered California, or is the option mostly covered California?
You know, that's a good question. There are some changes occurring in that marketplace where the quantity of those off-exchange plans, just to give you an example, last year the quantity of those off-exchange plans basically was equal to what we would see in quantity for marketplace plans. But there's been some changes from carriers filing their plans this year, and I would say it's a little bit less than the quantity on marketplace. But there's kind of an ebb and flow with that dynamic, and I have a feeling, my prediction is that next year that will come back. And obviously I don't have a crystal ball, but that's when you look back over the last few years, that's how that marketplace has evolved.
Okay, well, we're nearing the 11 o'clock hour, and we still have a number of questions that we would like to respond to, so we will be getting back to everyone individually with the remaining questions. We will be sending out a copy of the PowerPoint presentation to attendees, and then this webinar was recorded and is available through the website cacitiesmarketplace.org under the webinar tab, and that will also include information about additional webinars. But for now, I'll turn it back over to the presenters.
Thanks, Norman. Just a couple more notes before we wrap up here today. We all appreciate your time and know it is very valuable. So we appreciate that you took time out of your day to join us for this presentation. We have a couple of save the dates that will be coming out in the next couple of weeks here. Wednesday, August 31st will be an active employee solution specific presentation. And Thursday, September 1st, will be a retiree specific solution. There will also be additional webinars available specific to certain entities. And again, you can go ahead and join us at cacitiesmarketplace.org for additional information and click on the Contact Us button in order to schedule separate time to speak with us. Last but not least, you will be receiving a survey. Your feedback is valuable and appreciated in terms of the participation in that survey, so we thank you in advance for that. And I'll leave our contact information up here as well in case you'd like to contact us separately with any specific questions to our separate parts of the presentation today. So thank you very much again, and I hope you have a wonderful rest of your day.